Robert Eade is Head of Policy Exchange's Health and Social Care Unit and is with me now. What level of support do you have for the health sector's stance here? Good morning.
Hi, good morning, Nick. I think we are supportive. The statistics that you outlined, you're absolutely right that it will make up 44% of day-to-day spending. Obviously, that does exclude things like welfare payments and pensions, which are a big cost to the exchequer. But we think that something quite radical needs to be done around the NHS. And Sajid, I think, has been quite consistent. He said this during his big reform speech in March at the Royal College of Physicians. I was in the audience and there was quite audible shock amongst the healthcare leaders and community there. And he's reiterated it today, or yesterday rather, in front of healthcare leaders up in Liverpool. So he's run 6 departments. I think he understands the context in which the NHS has to fight for funding alongside other departments. And I think he's decided to challenge its hegemony, I guess, and control.
What should its level of expenditure be?
Well, I mean, we do contribute sort of about average compared to OECD comparator countries. So if we want a better healthcare system, if we want to be like Germany, we will have to put more money in. So that's the equation.
How does the German system, sorry to talk over you, how does the German system work?
Well, they have a sort of Bismarck-style healthcare system rather than Beveridge. So Beveridge, everything is free at the point of use. Bismarck is a sort of blended social system. Our personal view is it would not be worth the effort and the pain of trying to switch to a different system. You need to work within the current system, which is taxpayer funded, but make it work better.
Is there enough money already within the NHS?
It's difficult, and the pressures that you outlined in A&E, they are really genuine, and we hear that. We do, however, spend billions on preventable ill health, so the spending is not equal. We recently did a piece of work at Policy Exchange looking at specialised commissioning. We spend more on that one part of the NHS than we do on police and fighting crime each year. So the numbers are enormous. What you should be doing is cutting down on things like smoking, which costs the NHS $2 billion a year. We know that we spend about $7 billion fighting obesity and the sort of consequences of that. So I think the only way that the Conservatives can bring spending under control, if they're serious about it, is to get ahead of this stuff, to get upstream.
I mean, I appreciate we're dealing with people's health and in some cases people's mortality, but the tax take from smoking is going to be greater than £2 billion, isn't it?
No, but the total cost, I mean, they might raise, I think the Treasury raised about 10 billion through tobacco, duties and levies, but the loss of productivity, I mean, the
How is that measured?
Review that came out last week, just loss of economic activity. The Javid
But how do you work out
if pretty compelling statistics on the impact, and it far outweils, Nick.
But hold on, if Bob the Builder is being treated for cancer, how do we work out how much of a dent to the economy that is with Bob the Builder being in hospital?
Well, clearly it's been calculated. I would suggest.
But how? How does it? I don't understand. I don't understand how you put a figure to it. I don't understand how a figure is put to it. Do you know how it works?
Well, I mean, the loss of productivity that comes from people being out of work.
No, I work. But how do we work out how much Bob the Builder is worth to the economy? Bob the Builder is hospitalised for 3 months due to cancer. How do we work out? How do we put a monetary value to what that means to the economy? That's what I don't understand.
Well, obviously they do measurement in terms of our productivity and output, and you'll have seen those reported in recent growth.
I don't think anybody. I think they make it up. I think they just pluck a figure. I think they just say, I'll tell you what, if for the purpose of debate we've got 5 million people who are having hospitalised treatment, let's say it's a hit to the economy of £7 billion, and everybody says, oh, that's terrible. No, how can you ever equate? I don't see how you ever equate that number. Grateful for your input. Thank you. Robert Eade is Head of Policy Exchange's Health and Social Care Unit.